Hey everyone, I'm Greg Nettle and I serve as president of Stadia Church Planting. Stadia plants churches throughout the United States and around the world that intentionally and strategically care for children, because we know that the next generation matters to God and matters obviously to us. I'm so excited about today's webinar. We have amazing guests on this webinar. I was reading their biographies in advance and just went, wow, what an honor to have these guests with us. And this is going to be one of those webinars that even once it's recorded, you're going to want your church leaders to be sharing it with multiple people in your church for sure. Hey, we have our chat line open. So if you want to, say anything to each other on the chat line, feel free to use that. As you come on, would love to hear who you are and where you're from. It's always good to give you a shout out. If you have questions throughout the webinar today, please use the Q&A bar, and we'll try to get to all your questions throughout this time. But once again, I'm Greg Nettle. I'm president of Stadia Church Planting. We have an amazing team that's ready to help you. And, for Stadia, we're a 100% virtual organization. We have been since our inception 17 years ago, which is kind of crazy now that I think about it. But this is normative for us. This is how we meet every day. This is how I have Zoom calls with our partners around the world like this. And it's really fun. So we're looking for new innovative ways to continue church planting in this digital age. And so we have some digital church planting cohorts that are starting up. You can go to www.stadiachurchplanting.org and check those out. And that's for those of you who want to move forward with church planting in a digital space. And I think you all need to check that out. This is not going back to life as normal. It just will not happen. Digital is here to stay, and we need to be exploring all of the avenues that we can to move this forward. Okay, we're going to get started here in just a moment. Let us know who you are as you come online here and where you're from. But here's one of the things I want to do. We're going to throw up two slides right now. We have a poll that we've been encouraging church leaders to jump on. And I want you to look at this slide right now, because this is really important for today as well. Thousands and thousands of leaders of churches across the country are responding to these polls every week now. 31% of churches reported that people in their church have COVID-19. That was up from 21% all prior weeks since the poll launched on March 20th. Lots of interesting stats for us to get. Look at that, 70% churches reported that giving is the same or higher from before COVID. So that's good news. Lots of important data. Now, the fun thing about this poll, you can use that within your own church or within your own team as well. At Stadia, we actually send out a poll from inside of this to our staff every week, just to hear how they're doing spiritually, how are they concerned, how are they doing physically, all different kinds of things. So we know what's going on even with our own staff. You can do that with your individual churches. Let's throw up the next slide now. And you can just go to the website that's listed there. We're going to put that, actually, it's in the chat room. It's on that slide there. And you can go there, sign up. It's free. And by the way, we don't make any money from this. This is just a tool. It's a free tool. It will have huge benefit to you. Please take part in that. Okay, let's get going with this webinar. Really excited about these guests we have with us today. Valerie Grimes, thank you for being with us. Valerie, take just a few moments and kind of give us your background. What's going on in your life right now?
Well, it is so good to be here, and thank you for inviting me today. I am a registered nurse, and that's one of the things that brought me to this call today. I've been a registered nurse for 24 years, and I came into it as my calling. I can honestly say that, first and foremost, I am a follower of Christ, and that was one of the places that he led me into. And so I've worked in different areas in nursing. My first area was labor and delivery. And I tell you, if you want to learn how to love people, you go right in there because moms come in with some major things going on, but we come out with a beautiful, beautiful results. And so that also, I think, has led me into where God is bringing me in the kingdom, into birthing souls into the kingdom. And I think that's an amazing, amazing
Valerie,
thing.
Valerie, tell us about that. You're getting ready to plant a church.
Yes, yes, I am. And I bring to the table those years of working in labor and delivery. And we're excited. We are giving birth to Radiant Church in Savannah, Georgia. Our goal is to be planted in place in September. COVID-19 has some ideas about what it wants to do, but I believe ultimately God has the last say so. And another thing about us is that our vision is to be a church without walls, bringing the hope of Jesus to everyone, everywhere. And so we are a local church with a global mindset. And so that's the blessing too that God has given. And I've been able to travel to Dali, China and speak, and also to Ganta City, Liberia and speak, and just present the gospel of Jesus. And that's in my heart in every area, in every aspect of life that he brings me into. I must be about my Father's business. So thank you for having me here today. And I hope that I can add some value to this conversation today.
Well, Valerie, I hope the trip to China wasn't real recent. And
no, it wasn't recent. It wasn't recent.
I love Radiant Church's vision to help people lead radiant lives as they reflect God's love. So I love what you're doing. Hey, Casey, you and your husband Wes and I became friends, gosh, less than a year ago at a church planters assessment that I got to attend. And I was just so proud of you and Wes. Casey, give us some of your background. And you and Wes are getting ready to plant a church as well.
We are, yes. Yeah. Thank you so much, Greg and Stadia, for doing this and for asking me to be a part of it. It really is an honor. And when I did get to meet Greg it was in September actually of last year. That was a really life-changing experience for me. So I'm thankful for that. But yeah, so my husband and I live in New Hampshire. I am a native New Hampshireite. I've lived here all but 3 years of my life. So New England is home for sure. I work as a physician assistant in the emergency department at a local hospital. It is it's a community hospital, so nothing like in a major city certainly, but have been working in emergency medicine as a physician assistant for the last 15 years. And I'm also, I teach at a university actually in the PA program. So interestingly enough, and Dr. Tom Wood can speak to this more, I'm getting a doctorate in that program with a focus in global health.
Fantastic.
So we started all of that before this, and then what an interesting time to be involved and learn about global health. So we are starting a church here in New Hampshire. Valerie, I love what you said about a church without walls. And I think we get really excited about what church looks like in New Hampshire and in New England. We hope to, we've been doing a lot of online community outreach things now. COVID threw us for a bit of a loop, like most of us, right? But my husband always says one of the best things about church planners is they're adaptable, right? So I was a little, I was hesitant, wondering what this was going to do to our plans, but I think God had bigger and better plans, and it's been amazing to see how he has used this time for our church plant called Four Rivers Project or Four Rivers Church to really grow. So we hope to really start that service in the spring of 2021. But yeah, it's been great to be here, and thank you.
Thanks, Casey, for joining us. And we have Dr. Tom Wood with us. He's asked me to call him Tom, but it's killing me to do that. I read his biography, and this man's pedigree and influence literally around the world. Dr. Wood, thank you for all you've done globally and continue to do. But now you're with Samaritan's Purse, and it's an absolute honor to have you on this webinar with us today. Kind of give us just some background and what you're doing right now.
I just can't keep it as short as I can because, you know, how do you cram 57 years into a couple of minutes? But last 10 years have been very exciting time because one is, and thank you for the opportunity to sit here and share about it and to talk about an organization I'm very proud of, and that's Samaritan's Purse. And then, of course, we are proud that we are Christian evangelical and we're out there saying so in the world. It gets in trouble occasionally, but that's fun. I have been in the field of tropical disease and epidemiology since I was 23 years old. I'm now 85. But there's nothing in the Bible that says retire except one word, and that was when the priest went from handling the heavy objects to letting the younger men handle the heavy objects. And I don't mind doing that. But I'm a shoe leather epidemiologist. I prefer to be in the field. I'll do work behind the desk if I have to in this electronic age, but I prefer to be in the field. I started with Samaritan's Purse back when God called me. I'd been on a trip to help rebuild a chapel in Liberia, in Yakepa, Liberia. And there he introduced me to a need that was out there. And when I was on the way back from that, I had emailed the leadership at Samaritan's Purse and said, hey, I've got, God's laid this ministry on my heart. And long story short, about 3 months later, I ended up employed by them, even though I told them I did not want a job. So anyway, that was in February 2010. And if we think back about February 2010, what happened then was the big earthquake in Haiti. I was on the ground in Haiti 10 days before I was supposed to go to work for SP, but with SP 36 hours after that earthquake. Since then, God has used every skill and every training, everything that he's ever trained me. I like to work on things. Angela, can tell you about that. I've done things like repair welds in the middle of Africa, in this job. When I went there for epidemiology and there was a well that broke down and I knew repaired. So he uses everything. And, so I worked through the Ebola crisis in Liberia and through the Ebola crisis in the Democratic Republic of the Congo. The cholera, of course, the big epidemic that hit Haiti shortly, 10 months after the earthquake. And just God put me in a place where he uses every skill that he gave me. And I am so proud to be able to put them to work for him. Okay, that's it.
Yeah. Thank you, Tom. And hey, just let me say first, as we get started here, Casey and Valerie and Tom, from all of us who are followers of Jesus and listening and joining in, thank you so much for your work on the front lines. I can't even imagine. I know we're going to hear a little bit about it today, but what you've been going through and your families have been going through, and just I'm so grateful. We're so grateful for your willingness to serve and be the hands and feet of Jesus in really challenging times. Casey and Valerie, I want to just jump in here. You're emergency room. You're right in there on the front lines. What do you wish that those of us who are church leaders, those of us in the church, what do you wish that we knew about kind of what healthcare workers are going through right now?
Well, I could start, I suppose. I've been thinking quite a bit about that since we sort of started on this journey of doing this talk. I think I would say, and Valerie, I suspect you would agree, of all of the coworkers that I have that are working in any capacity, nursing, physicians, and nurse practitioners or PAs, I think we all feel like we're doing our job. I don't think any of us feel like heroes. I feel like I get up and I go to work and I'm doing what in my mind God called me to do, but what any of us signed up for. And of course the necessity of having, protective equipment and all of that matters, right? But I think aside from that, we all get up and go to work and every day recognize the risk involved. It's just a bit bigger now. I certainly don't want to imply that where I am at is anything like New York, right? I mean, the hospital I am at and what I deal with on a regular basis with patients and what we deal with is still intense, but it's nothing like what they're dealing with in New York. So I can speak from my perspective. But I think speaking to folks that are pastoring churches or starting churches, I think from a healthcare perspective, someone that works in healthcare and, as you say, on the front lines, I think recognizing and encouraging people that are in that same position, that this is really a really rich time to engage in some pretty amazing conversations. I think in healthcare, we are very used to dealing with life and death on a daily basis. And so we have a lot of ability to have really meaningful, purposeful conversations with patients and with coworkers. But I think this is a time like none other that I'm seeing that people really, again, coming from New Hampshire and New England, going to a church service, logging into an online service in the midst of a pandemic or a crisis, looking for hope and faith, that's not the first thing people are going to turn to, right? That's just not in their wheelhouse of this is what I do to cope. I go to church. We're in a pretty unchurched area. But people, especially in healthcare, I think are very willing to have, especially in these types of times, really meaningful conversations about faith and hope and where that comes from. I think, I think what's been exciting for Wes and I is we've sort of embarked on this journey in the midst of this is for us to be able to engage with people we've known for years. We happen to be planning a church in the place that we've lived for 14 years. So we've been able to really engage in pretty meaningful conversations and just trust that Jesus brings people to Jesus. We just rub shoulders with them and provide opportunities, and so I think that's what I would say I would encourage to the healthcare workers, to folks within church communities wanting to encourage healthcare workers to just focus on the Jesus mission, right? To just rub shoulders and be encouraging in a really rich time. I think that we have opportunities to do that now that we didn't 3 months ago.
Okay, so people are more open to the spiritual conversations than ever before, even in the medical community, which is typically a more challenging group of people. So that's great to hear. Valerie, let me jump over to you.
Yes, and just like Casey said, we don't really see ourselves as heroes. We see ourselves as doing our ordinary duty. The heart of healthcare, the heart of the healthcare worker is to give. I mean, I find that that's for the majority that's what it is. And but I think the conversations are key now. If you are a pastor of someone who works in healthcare, reach out to them, just call and say, how was your day? Because coming home after a day where you've dealt with patients that could potentially be COVID-19 positive, and you're having to take your clothes off in the garage and your shoes, and you can't touch your family, you've got to go straight to the shower, your mind, you've just got a lot on your mind. And yes, it's what we do, but it is a very stressful time. So if you are a pastor of someone who is a nurse, a doctor, someone working on the front lines, please reach out to them. Let them know that you are praying for them. Say, hey, can we have that conversation? And for people who don't live for the Lord, if I know for me with my coworkers, a lot of times I just begin to talk about the hope that I have. And it's not even the Jesus, 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 but it's, there's something that keeps me. And when you start talking that way, they're like, what is it? What's different? And then we're able to have that conversation. So definitely, pastors, reach out to those people and let them know.
Okay, let me ask you this, Casey and Valerie. Because we as followers of Jesus and church leaders, our churches are wanting to care for, I know you're saying, I get the whole we're not heroes stuff, and I so appreciate that. And I know that's your humble servant spirits, and I get that. But from our perspectives, you are heroes. Okay, so it's a two-sided kind of thing going on there. And so, what are some things that at a real tangible level, Valerie, I loved you saying, pick up the phone, and if you have medical workers that or they're in your church community, call them, let them know, but okay, so at a practical level, I mean, did medical care workers like when we as churches bring donuts or what are some practical things seriously that we as churches can be doing to care for medical workers right now?
Well, I would say this is Nurses Week, nurses and educators. So to let you know that this is National Nurses Week. And the ladies of my church, we're putting together packets to take into the nurses. And we actually right now, all of the entrances are closed for us except one. So it's perfect because we're all going to be going in one way and coming out one way. So we've put together care packages and we're just taking them, let them know we love you, we're thinking about you. We're going to have signs and pom-poms, and, just to let them know something very practical like that. And nurses love to eat. We love to eat. So yes, just something like that, just says I care, we're thinking about you, and we see you.
Love that.
I think that, so I agree with you, Valerie, wholeheartedly, that some of those very practical, there's been folks that have done chalk drawings outside of the hospital, yes, saying thank you. We've had to get really creative because some of the typical ways, like delivering food, right, we always have food in the emergency department. Anyone that's worked in an ER knows there's always food. It is not a place where you go to like be on a diet, but our hospital isn't accepting food, right, from the outside, and they're not accepting. So there's a lot of limitations now because of COVID that limit the way that we can engage and support each other. And so I think, Greg, like you mentioned in the beginning of this podcast, this idea that we're moving into a digital world, right? I think this is a time that I think you need to have the personal connection, like Valerie said, the hands-on, the face-to-face, but we're limited in how we can do that right now. And so I think as churches right now, if we can try, I don't know if capitalize is the right word, but really invest in doing things, being the hands and feet of Jesus digitally, whether it's, I know back in the beginning of this, I sent a text message out to about 30 of my coworkers that I used the verse from John, in this world you'll have trouble, but take heart, I've overcome the world. And these are, I don't know, maybe 10 of them know anything about church and the others do not, but it was such a good time. People are willing to hear that kind of simple message. I didn't say, come to my church, or it was like, here's a little bit of hope. And like, I think you're amazing. I think what you're doing is amazing. I think if you can find creative ways that your hospitals and communities, like Valerie said, allow you to do hands-on, face-to-face, personal interaction, encouragement, like what you said is so fun, the pom-poms and outside, and I love that. But then also use the digital ability we have to connect, maybe to get creative about that.
So I love that. And I think, one of the other things we can do is just make a commitment to praying for you all. And then, and again, if you know someone, back to your digital thing, Casey, is just texting Casey and saying, hey, Casey, I want you to let you know that I'm praying for you every morning, that you'll stay healthy and that your family, will stay healthy through this. And then actually praying for people. And that means the world to people. Hey, Tom, let me come down to you now, because you're kind of the wise sage here on what's going on with the pandemic. Talk about what we're seeing right now. Let's start right in the United States, and then we'll move global, Tom. But what can we expect right now? Because we've got churches all over. In Ohio, we just, where I live, we just got word shelter in now through May 29th, which is a big surprise to us because we thought we were going to open up a little bit. And churches are asking questions, when can we regather? So, Tom, let's just talk a little bit about that from your perspective.
Yeah, it depends on the part of the country you're in. This epidemic came at the United States from the two separate coasts. We all know it first arrived up in Washington State and, in the Seattle area, but it shortly thereafter arrived in New York, and, it caught fire in New York. That's largely not been anything the New Yorkers did. It is because of the density of the population there. That's one of the most densely populated areas in the world, and those people are in very close proximity, and of course the virus really loves that, and that's the reason for the shelter in place orders, is to, is we're with our family or in our home, hopefully you're with somebody, and a pet if nothing else, with Jesus all the time, but telling to be separate, to not to provide an environment for this. But what's going on in the United States is it hit those coasts. New York is really kind of coming down. In the last few days, we've watched it drop dramatically, the number of cases, and they're getting a good handle on it there. And the West Coast has kept a handle on it. But it has spread in both coasts, and we've got it now. It's arrived in Phoenix and in spades. Along the western in Nevada and along the western border of Arizona, and it's coming from the other direction. And big. If you looked at a map, Johns Hopkins University publishes a dashboard, and if you look at that, the entire United States is red, and the red is where this virus is. But more predominantly, it's from the Mississippi River east. where it's hot. And the big cities where we're watching very carefully right now are Detroit, Cleveland, Chicago, and areas like that. Texas has done a good job. I'm a Texan now by adoption, not by birth, but the southern states where the temperatures are coming up seem to be doing better. Florida's doing a good job, even though they've been not nearly as strict as some of the other states on their lockdown procedures. But I think that's a matter of sun and sunshine and hot air, and that's an enemy of this virus. So, where's it at in the United States right now? Particularly, it is hitting the Midwest and upper Midwest as they're coming into their cool springs, and it's an area where you're going to see this for a while. You just said your state's locked you down for another month. The governors are in charge of that, as we've heard about the lockdowns, and each one of them is going to respond differently. Internationally, the virus has gone through Europe about the same time it went through the US. In fact, that's the way it came into New York. It came out of China into northern Italy, and then from northern Italy all over Europe, and then from there it came across the pond and hit us on the East Coast. So Europe is under control and going down. The Middle East right now is pretty hot. Iran, Turkey are very strong, with what's going on. The place we're watching the most carefully right now are the big, the country India with 1.4 billion, a third of the world population. And what's going to happen there, and it is on the rise there. It is exponential in Russia right now. And it's just been introduced. It's been in Africa for a while, in South Africa and in Algeria, but it's now made its way into Central Africa, and we're beginning to see exponential rise in the number of cases that are coming up in the Sudan, in Cameroon, in the Congo, in the Republic of the Congo, and Nigeria, places like that. So any place where we're working in those areas, you need to continue to be careful. In fact, most of those countries have locked themselves down. They've stopped all traffic in and out of the country. So, okay.
Okay, so because as followers of Jesus, we obviously care deeply,
Amen.
as God does,
Amen.
for all people around the world. And I've been extremely aware. Stadia does a lot of church planting in South America, Ecuador, Guayaquil, It's just getting crushed right now.
Right.
We have lots of church plants down there doing lots of work, in South Asia, India, and different countries. And we're just we need to be praying for those church planters and for those followers of Jesus.
Amen.
Where there's no medical care, extremely dense population, unimaginable poverty, and we need to keep them in our prayers. And Tom, you said when we were chatting earlier that about the face masks and needs. Is there anything we can do to help that process?
Well, if you've got people down there and you've got a way of getting it to them so that they can get it primarily to their medical providers, as getting them, what we call PPE, personal protective equipment. Gloves. I have seen people get Ebola in Liberia because they didn't have gloves and then they took care of patients. Like you say, the healthcare workers are I cry about this. They're the heroes on the front line. They expose themselves. I've seen person after person do that. They care for people and they don't have the things to protect themselves from it. But things like gloves, plastic aprons, and masks and face shields. The mask is not to protect you from getting Ebola or COVID. The mask is to protect somebody else from getting it from you. It's spread by droplets in the air, and the mask, if you breathe, sneeze, or anything, you're going to be putting droplets out, and the mask keeps you from infecting them. And so, so people are wondering, well, what does this, bandana across the face that you see in a lot of places now do? Well, it doesn't do anything to protect you, but it certainly will take out a lot of droplets from your breath that will protect others if you happen to be infected.
Fantastic to know. Hey, Tom, one other question here, because you're working with Samaritan's Purse. Do you all have somewhere, like, are you is Samaritan's Purse distributing the PPE?
We have, we have outreaches in, I think the last time I counted, it was about 20 countries around where we have permanent stations on place. Plus World Medical Mission sponsors about 127 hospitals, missionary hospitals across. We're trying our best to see that they're equipped, as they, but if you've got contacts in churches in these smaller villages, we don't have those contacts,
Okay.
and use them to get, what we can to them. And a lot of it's going to depend on whether their government, lets it get in. But we can try our best to get them that
Well,
stuff.
we at Stadia, just to kind of give everybody a teaser, we're doing kind of a videothon on Sunday, May 31st, to raise $325,000 for India, and would love your help, all of you, with that, because that money will go right there to help the church planters and for them to care for the people of India. So that's on Sunday, May 31st. Hey, Casey and Valerie, let me come back your direction now. As one of the challenges for us in church right now is, if we have someone we love who has COVID or is in the hospital or that we know has COVID or is in healthcare for any reason right now, we can't go visit them. Can you make some suggestions? How do we help our people through this time, care for people they know, loved ones? Any suggestions you might have, Valerie?
One of the things that we do at our hospital is we make sure that the patients that are not on ventilators and are able to communicate, that they're being able to do FaceTime with their family members so that they can, stay in touch with them, let them know how they're progressing. And if anything changes because of this, there's HIPAA laws in place where we can't really share too much information. But they have to have someone on record as their proxy that we can communicate with and keep them informed. And the nurses, the doctors, everyone that I've come in contact with, they've been really, really good about making those phone calls. And so, it gets busy, it gets hectic, but we want to make sure that they have that contact with family members as much as possible.
Yeah, Casey, what are you seeing?
Yeah, I would say that same thing for sure. I would say that's where where I start to get a little bit more emotional, and when I think of the physicians and the PAs and the NPs and the nursing staff that take care of these patients physically, but then have the other side of it is communicating with family at a distance, because family members aren't allowed in, and that's almost as equally as important as the physical part. And it takes a lot of time. It takes a lot of communication and ability to do that well. I think one of the hardest things, Valerie, I suspect you would agree, that I have found is this is a time where patients really need a lot of reassurance from their healthcare providers.
Mm-hmm.
And I walk into a room to see a patient and I have a mask on, I have a head covering, I have 2 pairs of gloves, I have a gown and oftentimes goggles or a face mask. So they can't see my facial expression. I can't touch them very much. Some of the providers I've spoken with have taken to, seeing a patient once and saying, I'm going to minimize use of PPE and exposure. So when your results come back, I'm going to call your cell phone from outside your room. I mean, it just goes against everything we do as medical providers. But I think people are trying to make a lot of efforts. I think the ability to FaceTime and call into facilities, I don't know how well you could do this in a hospital, but I know something practically speaking we did with Four Rivers Project this a few weeks ago is we partnered with a coffee house called the Freedom Cafe that does, they do open mic nights. They've taken to doing open mic nights virtually. And so we switched that up and did it during the day for 1 hour. And we called into several local nursing homes because, oh my goodness, let's not forget what those folks are experiencing. They have these folks in nursing facilities can't leave. Nobody can come in, and all of their activities that they do on a regular basis have been canceled. So I reached out to some of these facilities and they thought, oh my gosh, whatever you can do for us, these poor people are just aching for some sort of connection. So, if there are churches listening now that have the ability to call into hospitals, if that's possible, and do something virtually, but to give some sort of human connection, I feel like that might be where we're at for now.
Man,
practical.
I love the idea of going, thinking creatively about how can we bless those who are in assisted care, nursing homes, all of those things, because that's a specific commandment from Scripture, right? Is caring for the elderly, the widows, and so forth. Yeah, Valerie, let me jump over to you.
Yes, one of the things that we're doing here in our city, you think Savannah, Georgia, it's one of the largest cities in Georgia, so you think they would have already been, collaborating. But we found, and the Lord, I can't take credit for it, the Lord just dropped it in my spirit. We found that people were working in silos. The government was doing their thing, the hospital was doing their thing, the nonprofits were doing their thing. And so what my group has done, and haven't even really launched, is that we put together what we call community talk, ripples make waves. And it's a call on Sunday. We let the community leaders, whether they're a nonprofit, for-profit, part of the government, anyone, citizens can join in on the call to let us know what you're doing in the community and how can others get involved in helping you. And also we're talking about plans going forward. How do we stay a united Savannah going forward? And we have had physicians on the call. We've had the nurse manager for the coastal health district. We've had councilmen and our county commissioners on the phone. And what's happening is we're seeing that they are starting to collaborate. So one group may say, we're doing this, and another group is like, oh, wow, we are too. And so they kind of join forces. And people who may have deficits, we have one employability, they needed electronics because their disabled patients were now not able to come into the center and they had lost contact with them. And so one company was offering free internet, and then another one said, hey, we have some Kindles and some handhelds that you can use. So it's like just bringing that ability for organizations to begin to collaborate. So I'm really thankful for God putting that in my heart. And like you said, I would have thought it would have been something going on already, but it wasn't. And God has put us in that place. So I'm grateful for that.
And so I think this is really important. All you church leaders that are listening now, we have to look at this as a time of opportunity for followers of Jesus. When things are at their darkest, the church shines brightest, okay? And so how can we think innovatively? I mean, even as we're going through this, my mind's just starting to buzz. I'm on the teaching team here at our local church, and I'm thinking, I preached last weekend for them online, and I'm going, man alive, I could have a video with Valerie talking, at the beginning of the online service about how can we care for people this way, or have Casey come online, or someone in your church, right? About here are some things we can do. Or maybe we have a specific time and we just ask all of our healthcare workers to join us on Sunday afternoon for 15 minutes, that's all. And say, we're gonna have a virtual Facebook Live thing, and all we're gonna do is pray for you and your families. And how can we think innovatively and creatively? Invite all of your medical friends. Just 10 minutes is all we want, just to pray for you. And again, no strings attached, but how can we be innovative that way? All right, Dr. Wood, I want to come back to you because now, I'm reading all these articles now that, okay, even if things are, may lighten up in some states right now, everything's saying, but this fall, what are you thinking about? Are we going to see another resurgence of COVID, or, are we out of the woods after this summer?
There are a number of factors that come into play when you ask that question. It's a good question, but right now, this is a brand new disease. It's the first time the world has taken a look at it. It popped up in December last year, and a number of pneumonia cases outside Wuhan, China, and it's new for us. And so for us everything you're hearing about what could happen is just that it could happen. It's speculation. If it's like flu, it'll be back. If we get permanent immunity from infection, and we have a lot of people out there who've been infected who don't know it, because of the silent infection. This one causes no more than the common cold or less than the common cold for some people, and that we elderly have to watch it because we're the most susceptible. But will it be back? Well, the answer is that it could be, and it has every possibility of not being gone. Things go down in the summer for a number of reasons. People, get outdoors. They become less, packed together in classrooms and things. And the weather is good. So you're out there and you're breathing fresh air, not breathing recirculated air in a room or in an environment. So there's a number of reasons it goes down in the in the summertime, and then the warm air, the hot air, and the sunshine are of course enemies of this. So when that all goes away and fall comes back, yes, it could be back. It won't be as bad. Hopefully by then, if we pay attention to our president, we could very well have a vaccine by then. It's being worked on not just by us. It's a very hot topic and a very big pursuit worldwide. And so, with molecular biology and the advances that have been made in that field, very likely we will have by then we'll have a vaccine. I would advise everybody to take it. The anti-vaxxers are out there. They and I have a few words about each other, but that's all right. They're entitled to their opinion. Just enough of us will get vaccine, and next enough of us will have the disease. It isn't going to come back like it did now.
Awesome.
Okay.
Okay. Let me ask this, because we're all, the big question in churches' minds and church leaders right now is, okay, when can we regather? And, so, I mean, in Ohio, that's not going to be an option for another month. But, in a lot of states right now, they're saying, okay, you can gather in groups of 30 or 50 and some places up to 100. Any wise counsel from any of you? I mean, I would love to hear from the medical community, what your counsel is on that, Tom.
What they're doing is saying about, gathering is in limited groups. Our church, for example, we desperately, we're a touchy-feely, support our local community church, and we want to be out there, and we're huggers. We want to wrap our arms around people and pull them in close. They're telling us that we can meet, and we can meet in groups of up to, 10 or 15 people, but we must maintain the separation. And our church, our pastor, and I think wisely, has chosen, okay, we're going to hold off just for a little while longer. When we get back to church, we want to be ourselves again. We want it to be full out church. So we're probably going to wait till about the time period you're talking about, but this is a self-election. Other churches are going ahead and getting together and calling on, on God to help protect them while they're there. But, my thing is, a church's responsibility is to take as much precaution as they can to keep, the vulnerable people in their community protected. And that was, so do the good things. I hate to wear my face mask. I do, because it's protecting somebody else. Wear a face mask, maintain the separation. For now, look with love in the eyes, because it's there. And, and then provide ample hand washing and sanitation stations, so that people can, if you come in and you put that hand sanitizer on your hands that's greater than 60% in alcohol, that's better than washing your hands. As far as, it kills every virus that's on your hands, and you're not going to spread it. And hands, touching things, and then keep your surfaces wiped down. Every door handle that gets touched and needs to be wiped down on a regular basis. Every counter. Our church, we sign in by the little laptops that are everywhere, and we just type it in to let us know, well, those can't be out. We call those fomites, and they're things that will take that virus and carry it around with them for a long time. This virus lasts in the air for about 2-3 hours, depending on the temperature and the humidity. It lasts on cardboard surfaces for 24 hours, and it lasts on plastic and hard surfaces like countertops and stuff for as much as 3 days. So we need to keep it, keep our surfaces wiped down and be about, practicing good hygiene for our people.
Well, Tom, you're just saying about the churches that might be opening now and saying, we're just going to pray to God to protect us. And yes, let me say just, boldly, and I know I'll tick some of you off, but that's just stupid. It's,
Yeah.
you can, because I think when God hears those prayers, he's going, look, I talked to your governor and told him to keep you separated. I'm not going to do any more than that. Listen to people. And if God's telling you specifically to gather, you do that. That's on your conscience and between you and God. I'm not going to argue that. But boy, you better have a specific word from God to do that.
Amen.
And to violate the best health practices. Because with digital church right now, there is no reason not to continue the advancement of the gospel. I'm watching it all across the United States and around the world. And there's just no reason why we can't move the kingdom forward. Let me come just over to you, Casey. What are you thinking about? What would you say to church leaders who are thinking about gathering, and got any wisdom or advice for them?
Well, well, boy, I am certainly not an expert like Dr. Wood is certainly in this field, but I think, I mean, no doubt moving forward, everything is going to be different, right? Even when we can gather again, it's going to look different. And I think we all know that. I can't imagine us being able to get back together before the fall in groups like we used to, and even then so. And so I think it forces us to get really creative. I realize I can speak from a place of, it's a little easier in some ways for Wes and I. We don't have a building to support. We don't have overhead. You know, everything we're doing is out of our house, right? So we don't have that pressure right now of needing to reopen. And we also don't have a group of people that are expecting things to be a certain way every Sunday. So we have the flexibility as church planners to get really creative. But I think the only other thing I would say is, I've been struck by this more so the last couple of days. And I hope as a church, we can decide to go through the next several months and the transition back into gatherings, which there's huge value in large gatherings. I mean, that's biblical. Is that we can go through it more with a mentality of abundance than of scarcity, and that we can start looking more at, you know, I think of getting together in large groups and this push to do that and what that does to the elderly folks in our communities. And that just, it doesn't scream Jesus to me. And maybe I'll get in trouble, Greg, for saying that, but Jesus, I feel like, would look at everybody and what was important and best for everybody. And it may not be best for me or my wishes, but like, I'm not going to put a bunch of 90-year-old people that come to the church that want to come at risk. That's just not how Jesus would do it. So I just wish we could move forward with this mentality of like, them before me, and there's enough and there's abundance, and we can do this innovatively and creatively, and it's going to look different. But it's okay to change things up a little bit. It's okay to not go back to the every single Sunday and push for that like tomorrow. We can
Yeah.
So like you said, there's no way that we can't continue to advance the gospel right now the way that we can.
I so appreciate that attitude about putting others before ourselves, because a lot of times I can get really selfish and think, well, my family will weather this, it'll be fine. But it's not just about us. And I think that's so right. My 4-year-old nephew had his 4th birthday party yesterday. And so a bunch of the family got together at the house and just sat on the front lawn, social distance on, lawn chairs and so forth. But here's what we discovered. The children, we couldn't social distance. I mean, they were just instantly, like this. Well, I feel for them, but it's not okay, right? Because children can still carry COVID and then infect the grandparents who are there. And so we have to be we've got to think about that stuff, as challenging and as much as we hate it, about protecting people. And I'm all for gathering as church. Please don't hear that. But I do think it's in creative ways of maybe gathering with 3 or 4 families as it opens up, and being involved with church online for as long as that takes till we can gather in the larger groups. Valerie, let me come back to you and just, what are you thinking there that, I wish Greg would ask me, or I want to say here to people, we only have about 10 more minutes here before we wrap up.
Well, I mean, this question that you're asking about gathering, I think is a huge thing. It's time for churches really to kind of shift their mentality anyway. We find that there's accountability when you have small groups coming together. So why can't we take advantage of this time to strengthen those small group settings? Like you said, maybe when we are able to come together, to let that be the beginning process, and even then that they do it responsibly, like you said, with social distancing, but that they're beginning to get to become a church of small groups where people are coming together. The accountability is there. We're learning about God together. We're sharing and doing life together so that when we do come back into that big gathering, we don't feel lost. Because to be honest with you, there were people who felt lost in those large gatherings anyway. And so this is an opportunity for them to begin to belong to the body of Christ. So let's strengthen that right now. Let's work on that right now so that when we do come back together, we are coming back as a healthy, whole body of Christ. And I'm not even talking about physical health. I'm talking about spiritual health, that we come back and we are ready to move forward with the mission of Christ. So slow down, and get healthy, both physically and spiritually.
Valerie, are you going to be on the teaching team? You going to be one of the preachers at your new church plant?
Yes.
Good. You should be. You should be. I'm gonna come down. My wife and we're gonna come down and visit your church plant. So
please do.
You've got that gift there, and I already know Casey does. I told her that when we were in assessment. I said, Casey, you've got to be speaking. You're a gifted woman that's got to get her voice out there. Casey, what do you think? As we kind of are wrapping this up, what would you say to all of us church leaders who are listening to this? How can we partner with you on the front lines to care for people in Jesus' name?
Yeah, I think it is. I guess for me, Greg, it comes back to, or it comes down to this idea that we really now have the chance as a church to live on mission with Jesus, and that we get to get really creative about ways to engage with our community and engage with healthcare workers. There are days, I'm sure Valerie would agree, there are days that I would get ready to go to work and I thought, this is amazing. I'm like leaving the house and it's like real life again. And then you feel like, oh my goodness, I'm entering the death zone in some ways, And so there's a lot of mixed emotions there. And I think we just have the ability to come alongside our community, our church members, those we're reaching out to, and just walk side by side and love them in the way that Jesus would, with, like you said, Greg, no strings attached. That's like one of our things with Four Rivers, is there's no strings attached. Like we just love God and love people. Like that's what it's about. And so I think we just have a really unique time now. No doubt it's difficult. This is a difficult time for everybody. And I don't want to minimize that. Things are certainly not all roses. But I think we have the time to be real and authentic and offer friendships and community with people in a really rich time where people are receptive of that. So I suppose that's what I would say, is just really engaging in people. It's pretty easy when you're stuck at home to just be stuck at home, right? And not reach out at all. And so I guess taking that step, actually not thinking about doing something loving and caring, but actually doing it, is what I would say.
So Casey, I so appreciate that. And just as a reminder, Valerie, I didn't know it. It is Nurses Week. And so, hey, we don't need Nurses Week. We should be doing that, caring for people all the time. But hey, it's Nurses Week. And we just found out, let's not let a single nurse in the healthcare profession go unnoticed this week, unprayed for, unblessed. Get on your phones right now, text a nurse. I've got one that I'm going to text as soon as I get off here, and just say thank you for being on the front lines and for caring people, and just love on people in Jesus' name. Tom, as we kind of close out here, my heart is just breaking for our global partners and followers, people around the world, because here's the deal. The reality is it's hard for us in the United States, right? But at the end of the day, I get a hot shower every morning. I've got food in my refrigerator, and plenty to eat. If I need to go to the grocery store, I can get in my car, one of our two cars, and go to the grocery store.
Amen.
I've got a roof over my head. I've got a comfortable bed with blankets, air conditioning, or heat, depending on what I need. And when we think about the people around the world that we care for so deeply, who are going to, bed at night in some of the most rancid conditions on the planet, who don't know, they're asked to shelter in, And when they shelter in now, they can't even get food because the food is so scarce. So you have a problem with starvation in many countries, as well as the COVID virus. When they're, they have these notices, they don't have running water to begin with. And now the sanitation spreads the COVID virus. Tom, kind of give us some insights, anything, in our prayer time, anything we should be thinking about, attitudes of gratitude, things like that, as we kind of move forward here.
Well, you're exactly correct. As I've traveled the many places that I've been in the world and seen the things that I've seen, I come back always knowing how blessed as a nation we are, but we're blessed so that we can be a blessing.
Amen.
And we're a Christian nation, and we reach out, and we're more part of the nation of Christ, and that's the one I keep focused on. But, you're right. They have nothing to be. I mean, I've seen people die in their little homes that they're locked up in, because they can't get out because of Ebola, much less COVID virus. And yeah, the suffering is going to be great. And anything that we can do, prayer, a lot of prayer, and a lot of reaching out in any way that we can to touch them. And this thing's throughout the world. I mean, you mentioned South America, and Guayaquil, Ecuador, was recently went through a terrible time in that there were dead bodies laying in the streets, people dying everywhere down there, and no place to bury them, and nobody, since it's calmed down, but that's happening throughout South America. Brazil is in terrible condition right now. Colombia is suffering and picking up the slack for Venezuela, where their healthcare system has been totally destroyed. So if we've got a way to reach to the churches in Venezuela, SP has a outreach on the border at one of the bridges, and we send supplies across that bridge on a regular basis by courier, and get them in as much as we can. But look for ways, innovative ways for us to pray and serve. It's God's given us an opportunity in this. To test us as a rich nation as to how we can innovatively reach out and touch the rest of the world, and we can do it.
I'm reminded of Psalm chapter 56, verse 8, when we're told that God knows about all of our sorrows and that He collects our tears in a bottle. And I'm even more reminded of the book of Revelation when God says, "But hey, there's going to come a day when I will wipe away every tear from your eyes." And
Amen.
That's what this is all about. We physically help people right now wipe their tears and collect their tears and weep with them and mourn. But we also bring the hope of Jesus to the nations and to every person we come in contact with, that there will be a day when there won't be any more tears.
Amen.
Valerie, thank you so much for your work and for joining us. The soon-to-be Dr. Dillon, thank you for your work and for joining us today. And Dr. Tom Wood, it is just an absolute honor to be on this with
please,
you. And,
I'm just Tom.
Well, thanks, Tom. I appreciate that.
I'm a little boy who grew up on a dirt street in New Mexico, and that's who I am. So, okay.
Sounds a lot like Jesus. Thanks, everyone. We'll talk soon and see you next week on our next webinar.
Thank you.
Thank you.
Thank you.